I know that several World Cafe events have been held. Could you tell me please how these worked and what the benefits were?
Yes, they were very good. The World Cafe as a mechanism for sharing information about healthy living pharmacy is well tried and tested. It's certainly, there were World Cafe events in Portsmouth and in Southampton and on the Isle of Wight. So we knew that the model was effective and worked. Hampshire, as I say, is very large geographically and a lot of pharmacies involved. So we ended up holding 4 World Cafe events. We're very fortunate in Hampshire and the Isle of Wight. We have a local pharmacy group structure already in place where we have leads out there in the community who help us with our training events, which we put on every other month for local pharmacists and local pharmacy teams indeed to attend. So we tapped into that local pharmacy group structure, and I got together with all the local pharmacy group leads, and we identified venues larger than we normally use. We funded the venues, we funded the catering, and we invited everybody in Hampshire to attend a Will Cafe event. The first one was in Basingstoke. I must admit, we did frighten the hotel where we were, because when I arrived they'd set the hotel out beautifully with white linen on the table, as you normally do when you're about to put on a buffet, and we stripped them all off and replaced them with paper tablecloths, because the Will Cafe event works where everybody gets together around a table and shares their ideas and their feelings on the topic, and there were various topics under Healthy Living Pharmacy as the umbrella. So Basingstoke, we had Mike Holden from the NPA, Chief Executive, who came back to give us his overview on the challenges facing community pharmacy and to really motivate people to embrace change, and he did a fabulous job. I think the next one was in the New Forest, and as we moved through the Will Cafe events, we attracted more and more people to attend. And pharmacists and pharmacy teams got together around the table and really discussed what healthy living pharmacy would mean for their local community pharmacy and how it would work in their pharmacy, because it's not a one-size-fits-all. We ended up in Horndean, where although 70 people said they were coming, actually over 100 attended on the day. That event we had Paul Edmondson-Jones, Director of Public Health, who was then in Portsmouth, who did the motivational and embracing change element of it, and that was really, really well received. We ran out of food, however, and I can tell you the caterer was not terribly happy. What have we got out of it? We've got a lot of feedback. We know teams are really enthusiastic. We also know, because we're realists, that this is not for everybody. So actually the Will Cafes helped people form an idea as to whether their team, whether it would be appropriate for their particular pharmacy and their particular team, and that was what it was meant to achieve. We've taken that feedback and we're using it as we develop our service specification and our prospectus, which is the part that we've currently reached.